Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, everybody. Happy Wednesday. Happy Hump Day. I am your host, Dr. Keisha Davis, with my amazing co-host, Dr. Sharon Smith and Dr. Dan. We are here on a Wednesday. It is technically in September 25th, when we're recording, and I wanted to do a couple of current events before we got started. I wanted to see how my co-hosts are doing. Dr. Dan, Dr. Smith, how are you?
I'm doing great. Thank you, and glad to be here.
Awesome. Dr. Smith, you're off call. How are you doing?
Actually, I'm not off call, but I'm doing great.
Great. Awesome. Well, I'm going to throw it to you first then, Dr. Smith, because I was reading this article. It's a great article. I will put it in the show notes so that you guys can read it. And it was about, by NPR, this alarming rate of preeclampsia, which Dr. Sharon will explain, and high blood pressure basically during pregnancy. They're seeing it, and since 2007, the rates of preeclampsia have literally doubled. They think it's partly due to increased testing and screening, probably just better diagnosis, but at the same time, they believe there's an increase in risk factors. So Dr. Sharon, tell us about preeclampsia.
So let me define preeclampsia. So preeclampsia is basically hypertensive disease in pregnancy. And we have preeclampsia with mild features and preeclampsia with severe features. So preeclampsia with mild features typically would have sometimes maybe mildly elevated blood pressures. When it becomes severe, then the parameters for the blood pressure becomes in the more severe range. Sometimes your laboratory values may be off. Sometimes patients may have neurological symptoms such as blurred vision, dizziness, nausea, vomiting also, or your laboratory values may be off, like low platelets, and even sometimes on clinical exam, epigastric tenderness, you might elicit that, or like a brisk reflex. Those are some of the things that we use to define preeclampsia and define whether it's severe or with or without severe features. But yes, we've definitely seen a huge increase in preeclampsia over the years. And there are risk factors for preeclampsia. For example, one of the risk factors is previous history of preeclampsia. Gives you a higher risk factor or higher incident of preeclampsia in your current pregnancy. Things like history of hypertension, diabetes, obesity, all of those are risk factors, and they're compounding risk factors also. Other diseases, like let's say cardiovascular diseases such as lupus, also put you at high risk for preeclampsia. So we definitely have seen an increase in preeclampsia. So it's not just the definition of the extreme ages now, where previously we'd see it in what we call the old, which may be a person who's pregnant above 35 years old or a teenager. Now, all bets are off. It's every patient at risk of preeclampsia. I've seen a lot of patients return who had normal pregnancy, normal labor, normal delivery, and they'll come back days or week or a few weeks out with severe, ridiculous blood pressure and with the diagnosis of preeclampsia. So definitely that's something we have to look out for. And even with normal patients, normal delivery, once we send the patients home, we're giving them the symptoms of preeclampsia, we're checking on them. And I'll tell them, I said, if you don't feel good, I don't care what it is, just come in, we'll evaluate you, because it is truly a high increase.
I love that, Dr. Sharon. If you're not feeling well, just call. It's better to be safe than sorry because there's no specific symptoms for it. So that's great. Thank you for that, Dr. Sharon. So it is still September. Climate change has done wonderful things, including expand hurricane season. We've already been affected here in Houston with Beryl. And basically, I think that we could say that our power and light were not prepared or ready for what we had coming. So right now, Biden just declared an emergency in Florida. The Hurricane Helene is headed that way. It was a tropical storm. They believe by the time it hits that it'll be a Category 4. We will see. It is September 25th right now in the evening, so we'll see how that goes. But one of the things that this article I was reading was talking about was, in the Houston Chronicle, was talking about preparedness for contacting people, right? Imagine you're in the middle of it. We dealt with it. We couldn't even get a signal through our telephones. And sometimes we have to go back to the basics. Something they mentioned was having a radio, an old transistor radio available. Also is knowing your neighbors, talking to your neighbors. We did a lot of that, being able to walk outside and talk to people and have communication in case we needed help. So those are two important things. But we have Dr. Dan here who wears many hats. And I'd love to hear your thoughts on disaster preparedness.
Yeah, thanks, Dr. Keisha. You're right on point. Disaster preparedness, used to be one of my other hats. And it is important. So one of the things we actually say in emergency management or disaster preparedness is actually, you don't wait until the emergency to start introducing yourself or giving your business cards or exchanging phone numbers. It's a little bit too late. You want original type relationships. So if this urges us to get to know our neighbors and associates in our neighborhood better, we need to do that ahead of time. That notwithstanding, to your point, you need to have certain things, what we call ICE contact in case of emergency. It should be in your phone. At least you can, if your phone does have a charge, you're able to look up that number. Whether you'll have access to being able to call them, that's a different issue. You may be able to text them. Ham radios are the ones you were referring to, which they usually talk about. Having water. So these things are usually 3 to 7 day supply, because before the cavalry comes in, that's like FEMA.
Wait, Dr.
And all the
Dan.
agencies. Yeah.
3 to 7 day supply or 3 to 7 month? Because
3
some
to
people
7, no, 3 to 7 day supply is a standard. And they can go to www.dhs.gov and go to that website, Department of Homeland Security under FEMA, Federal Emergency Management Agency, and you can get all the resources that you need. But those resources, let's break them down quickly into those for children, those for elderly, those for adults. So you can kind of figure out what your household looks like and then know what you need to do for those individuals. But usually they say have at least 3 to 7 day supply of water, food such as snacks, things like that. Your medicines, you usually say actually you should be having 60 to 90 day medicine on hand, because sometimes the pharmacy and things like that, if it's a really bad hurricane, you may need longer, to your point, Dr. Keisha, in terms of your supply. But at least before the cavalry comes in, meaning Homeland Security, FEMA, DHS, HHS, and all the other agencies, National Guard, before they can bring their support, they at least need to be prepared for 72 hours. You need to sustain on your own. And then the cavalry hopefully comes within that time period. So that's why they say usually 3 to 7 days. There's so many other things that you need to worry about, but I think the kids and your family members should know, where's our meeting point. Let's say we need to leave the house, or the house, God forbid, gets destroyed. We're going to meet at this place, or this is where we need to. You have to go through the drills. It's not to scare them, but it's really to get everybody prepared on what we would do to sustain ourselves. So again, for the elderly and the kids who have chronic medical conditions, always worry about their medication. They may need battery supply or charged equipment for their medical equipment. Some people are on certain medicines or on certain equipment that helps them actually breathe or helps feed them. So those are the things. And if you don't have any access to that, contact your health department. If you can't go there, go to the hospital or some type of shelter where they can actually provide you with power. We usually don't say come to the emergency department, but if it's a dire situation, you'll have to seek care, so we can at least get you some things or refer you to a place where they can give you power. Yeah.
That is great information. You know, when we were dealing with the hurricane this summer, it was very, very hot. So cooling centers, being able to know where to go to cool off for a lot of people was very important, even pets. So thank you for that, Dr. Dan. All right.
Can I just add something?
Yes, Dr. Sharon.
For me, as an obstetrician gynecologist, part of the hurricane preparedness is I usually tell my patients, the pregnant, especially pregnant patients, have a copy of your prenatal records in hand.
Great.
Have a copy of your prenatal records on hand. In addition to everything that Dr. Dan just said. 'Cause sometimes it happens. I've seen it.
Babies come anytime, anywhere.
They come anytime, and you need your records. It helps.
Thank you, Dr. Sharon. So last episode, we started talking about healthcare and the election. So we're back to it. We're going to go a little bit deeper into Medicare and Medicaid, prescription drugs, and mental health and healthcare access. So I wanted to divide those into segments. We're just going to give you a little bit of pointers that you can go with. Please, I will put some additional resources in the notes. And if you have any questions, reach out to us, okay? So first, let's talk about Medicare and Medicaid because there's been some misconceptions. Dr. Sharon, you were just sharing with me the other day that the one you hear about is that Medicare and Medicaid cover all healthcare services. So that's one. And the actual fact is coverage varies state by state, number one. And number two, it doesn't cover every service like dental or vision. And it really depends, especially with Medicare and state to state too. So is there anything else you want to clear up about Medicare and Medicaid misconceptions? And then I'll get into the candidates.
I think that the main thing is that people have to look at the policies. They got to read the fine print. And let's say they have a doctor's appointment and, you just have to know you're still responsible. Yes, we as a physician are responsible also, but as a patient, it's your health insurance. You're actually responsible for your premium and for the policy and for knowing what's in it. So one of the things I tell my patients is to know what's in your policy, know what's covered. And I know it can be daunting. It really is. It's a lot of information and it can be daunting. But at least try to familiarize yourself with what's covered and what's not so that when you come to the doctor, you're not shocked when I say, such and such service is not covered, or it may not be covered or only covered within a certain time period or time frame.
That's great. And one thing that can still be a misconception, Dr. Dan, is that if I have Medicare or Medicaid, I can't go to the hospital for emergency services.
Yeah, no, you can. If you need emergency care, you come to the emergency department. That's where you're going to get the care you need, at least in acute phase, meaning right then and there. But usually we like to see things that are, I guess, what we would consider life-threatening. But again, what you consider life-threatening might not be what the doctor considers life-threatening, but you have to go with how you feel. And then we can kind of tease that out. The health system is really scary for individuals, and even for me. I mean, when I tried to get insurance and I had to do private insurance on my own as I'm independent, it was literally, reading the fine print, to Dr. Sharon's point, is very difficult. I mean, you're like, okay, so they cover this, but they don't cover this, but during this time, this day, or this is how it is, or I have this kind of insurance, or if you need this kind of insurance, this is in network, out of network. What does that mean? Part A, part B, part C, part D. I mean, it's very confusing. So people shouldn't feel bad about it being confusing, but try to get help. And you can actually call some of these health insurance agencies. They actually have a consultant on site or their customer service. Some of them actually are really good. There's some that don't know what they're talking about, but a good number of them actually are well-versed and they can tell you what it is. And if you have a friend who's in the health profession, maybe they can help you a little bit, but it still is confusing. And hopefully we can get to a place where the system is easier, is better understood and somewhat easier and clear cut. But the way I kind of break it down in my basics for people is usually Medicare. You're thinking that's what covers the adult, elderly, and Medicaid is usually for the children, and it's provided by the state. So those are kind of some of the things that we kind of quickly tease out so people know which one they're looking at for their child or for their elderly family member, or even themselves as an elderly or as an adult themselves.
Those are great points. And I just want to cover briefly, just for everyone to make decisions for election. Trump has supported some efforts, but has not been successful in trying to repeal what is ACA, and that's the Affordable Health Care Act. Now, the thing about that is it included Medicaid expansion, so covering more people. There were provisions to help in restructuring it. He tried to actually block a grant on a per capita cap. He also was trying to limit Medicaid eligibility. So that's important to know. He did sign into legislation an enrollment requirement that in exchange for that, it enhanced federal Medicaid funding during COVID health emergencies. So just be aware that was something that happened. Not very clear on what his future will be as far as with Medicare and Medicaid. Just be aware of that, but you can look on his website. Harris, as far as with the Biden and Harris administration, we know that they had efforts, first of all, for Medicaid and maternal health. They reduced maternal mortality and morbidity with encouraging states to adopt postpartum Medicaid coverage extension, so making that better for those on Medicaid. The administration also supported legislation to establish a federal option to close the coverage gap. This was not passed by Congress, but they did pass a fiscal incentive for states to newly adopt the ACA Medicaid expansion as well. For Medicare, pretty much similar, and I'm sure you guys can give some comments on what you're seeing. Trump had proposed to accelerate Medicare price negotiation of drugs, and he did also extend the $35 insulin copay gap. These things through Harris and Trump have been continued. We know that they put the $35 cap on insulin. Harris, during the 2019 primary, she supported a Medicare for all approach, but she did say now she would like to seek advanced Medicare for all, not necessarily, but improve the ACA. So that's also going to help with Medicare and Medicaid. Any thoughts on those?
Yeah, I think an important piece is with regards to what the Biden Harris administration had done. So it's important for them to know there was been work that had been laid down. And without being political, Trump did some great things with regards to COVID, at least with regards to the medical countermeasure, getting the vaccine out and cutting through the red tape. So he gets credit for that. But I think where the lacking and where Harris and Biden come in, and President-elect Harris may come in, is with regards to access to the care and what they've done now with regards to price of insulin and even negotiating drug prices, which was unheard of. So I'm not a big fan of also the government controlling medication and costs from companies. As you know, I also wear a biopharma hat. But I do agree that, everything with regards to care and costs should be lowered and should be subsidized by the government the best we can. And companies need to be also responsible and also not price gouge. I think that's very important. And I think that's something that Harris is focused on. And I think it's definitely welcome. Nobody wants to go in business without having some profit. But there's also a difference between profit and greed. And I'm not for the greed.
I love that. And before we get to Dr. Sharon, the previous episode right before here, we talked about the federal government and the state and the difference that they have and the role they play in healthcare. So please listen to that to find that out. I want to tie it back because you were talking about prescription drugs, and that's actually the part two. And Dr. Sharon, I'm sure you can attest, is that we know that prescription drugs have been an issue here in the United States. The misconception is that neither side will effectively lower prices. We know that that's not true because they've been doing it, but it's a struggle, as you mentioned, with big pharma and the doctors as well, trying to find the right medicine. Something we've also seen is shortages. So in the middle of a shortage, you have a medicine that's covered for you. And I've been dealing with this with my daughter, and then all of a sudden that medicine is out and the next medicine is 3 times the price, but it's not covered by insurance. The fact is that under the Biden-Harris administration, there have been steps taken to lower drug prices. So President Biden did sign into law the Inflation Reduction Act with Harris. She actually casted the tie-breaking vote. And that requires the federal government to negotiate prices of drugs, as you mentioned, Dr. Dan and Dr. Sharon, for the first time. So it extended the $35 copay cap for insulin to all Medicare. She did say that she plans to make sure that cap on medicines happens in more affordable medicines for all, not just for Medicare patients, which I think is so important. Something that happened also during the administration is they dropped the out-of-pocket retail cap on all medications from $3,500 to roughly around $2,000 per individual. This is great because it's expected to reduce costs for millions of Americans by 2026. We shall see. We shall see. The other side, Trump and Vance's stance has kind of gone a little wavered. We know that Trump, he issued an executive order aimed at lowering drug prices. Many of his measures were blocked or reversed after he left. But Vance did mention, when we do talk about ACA, he did mention that there was a push towards deregulating healthcare, and that could limit the federal government's ability to regulate drug prices. So people have to be aware of that. All right, Dr. Sharon, any thoughts?
Yes, I don't, deregulating healthcare is actually not a good idea, right? Part of government is to fight for people who can't fight for themselves, right? So if you just deregulate healthcare and you leave it up to big pharma, well, a lot of them, they're really for profit. So then what's going to happen to the person who can't afford insulin? They can't afford even just basic medicines that would just keep them stable. Right? Then you have, advancement of disease. It actually ends up costing us more. It costs the system way more because then the diabetic who can't afford their insulin is going to end up in the ER with Dr. Dan, just saving their life. And that's that's really how it works. So I don't think it would never be a good idea to just deregulate healthcare and leave it to private sector. That's not a good idea. It's not good for us, the population. It's not good for anybody.
And I also think while we're on this subject, the whole part of government and external factors involved in healthcare, their parts, there's always, the good side and the bad side, a merit and demerit. And confusing medicine with politics or politicians regulate or government regulating how doctors practice also has been a problem. And I think that's something we saw during COVID. We've continued to see that with the whole Roe v. Wade overturned and healthcare, abortion care, or whatever phrase or term you want to use. But the point is, doctors, we got our license. It's an art. Practice of medicine is an art, and it's important for them to allow those within their license to do certain things as long as we're taking care of the patient. And we do have regulatory bodies that we do report to. But having the government now regulate or politicians now dictate what we're doing has caused more harm in the past 2 years, and we realized where we start mixing politics and medicine, it's a problem. So I need them to stay out of our business, and that's just my 2 cents for today and my stance on that.
He said that so politely.
Yeah.
I know, right?
Just please allow me to practice medicine. Yeah. I love that you mentioned the art of medicine. Dr. Sharon, I always hear her stories. Sometimes in the middle, you're dealing with a patient, certain demographic, certain lifestyle, and you're in an emergency situation and you're trying to figure out what is covered, what's not covered. Are they going to be able to adapt to this medicine? Or there's this medicine that they do great on and then all of a sudden it's not covered anymore. So I agree. You have to finagle, or you're waiting for now in Texas, because we found out United Healthcare requires pre-approval just for having a regular routine colonoscopy at your scheduled age. It's undue time. And for a person who is already nervous getting into the healthcare system or taking off time, they're not going to be able to keep waiting to figure out if now they can have that procedure or that medicine. Great. Anything else before we move on to the last segment, which is mental health and healthcare access? Now, we have basically declared, right, since the pandemic, a mental health crisis. And I want to talk about that in congruence with healthcare access in general, which is the ACAs. Now we have the Affordable Care Act. But as far as mental health, the misconception has been, first of all, we are in a crisis. It's not that bad. even with the problems with gun violence increasing, we're seeing more mass shootings. People are concerned that this is a mental health issue, amongst other things. We really need to get a hold of mental health coverage. So the misconception, mental health services are being defunded. That's actually not the case. And I loved finding out more about this because I really didn't know as much was going into it as it is. So the fact is that mental health funding has increased under the Biden-Harris administration. Particularly, they're focusing on addressing the mental health crisis exacerbated by COVID-19, and in addition, many other things, including vets. Trump's stance has been he focused on the opioid crisis during his term, but hasn't been really vocal, and we don't know coming up what exactly his focus is going to be for mental health funding. Agenda 47 did say this, and I'm just giving facts. Agenda 47, I'll give it, is on Donald Trump's website. He proposes a return to mental institutionalization. So basically, for those who are severely mental ill and disturbed, we will bring them back to institutions where they belong. That has been the statement. This is not my statement or reflected by anyone here on the stage. He also supported repealing the ACA and cutting Medicaid. Both of these would reduce coverage and access to behavioral health services. Contrary to that, he also did sign the pandemic legislation, which was the CARES Act. So he kind of has some contradicting things. You have to figure out what he actually supports, and that included an expansion of certified community behavioral health clinics through that legislation he signed. On the other side, we know what they have done, I've mentioned, but Harris and Biden and what they want to continue to do is advocate for increased mental health services. As vice president, she led the White House blueprint for addressing maternal health crises. This had steps that addressed maternal health, and she launched the National Maternal Mental Health Hotline. I love that. Biden-Harris administration also invested in expanding mental health and substance use treatment, including for children and families, which is important. They also supported the Safer Communities Act. That includes provisions to increase, and we have to deal with the schools. So this increases school behavioral health services and also strengthens the requirements for behavioral health for Medicaid-enrolled youth. I think that's so important. They expanded the Medicaid demonstration, which adds 10 new states to the program, and the 988 number, which was involved in the Trump administration, they have enhanced crisis care building and also dealing with training people to deal with that as well. So I think it's important that we talk about the mental health and who is going to help support improving it. Any thoughts, Dr. Sharon, Dr. Dan? And Dr. Dan, you sometimes have to deal with mental health crises in the ER.
Yeah, we do see a lot of patients. I mean, before COVID and, of course, during COVID times, but afterwards also. And mental health illness, especially among teens, we're seeing, which relates with drugs, the whole fentanyl, opioid crisis. I mean, so all of these kind of intertwine. Abuse in the family, which leads to mental illness, and just trying to fit in, financial situations. You saw how the prices of certain food items were very difficult, challenging for families with many kids, and if the financial resources for the community that parents can't get access to, or that a single mother or a single parent can't get access to, these all kind of feed on each other. So it's about the neighborhood, the area, the access, food deserts. I mean, there's so many things that actually go into mental health. I can't begin to tease it out, but I do see it a lot. And it's kind of sad because we also have to wait. Sometimes they have to wait a long time in the emergency department. What they're actually sometimes bordering, meaning they actually stay in there for days before we can get them transferred to get to a mental facility to get checked out. I mean, they'll do a screen in the emergency department. We have social workers, we have psychiatrists that will come in, evaluate them. But if they need to go to a facility where they need to be inpatient or hospitalized, that's the bottleneck. So they end up hanging out and sometimes in the ER for 4 days, 5 days, sometimes 30 days, sometimes 60 days. I mean, these are horrible things. Like, you just have a patient there kind of waiting to get those services, and we really have to do better with our system and with the medication. But it's not only always about med. Sometimes it's just the man and woman power, in the sense of having specialists that are dedicated to that field to be able to help them. And then the space, facilities, supervision in the facilities. Every state has a different way of doing it. Every county has a different way of doing certain things. Getting child protective services, but funding, all this requires money. And I think that's why we need to elect people into offices that understand the gravity of the situation and actually put resources towards that.
Great point. Dr. Sharon, any thoughts? I know you deal with pregnant persons as well, and I'm sure mental health can be difficult during that time.
Yeah. So everything that Dr. Dan says, actually, pregnant persons are not immune to any of that. I mean, I've had to get many patients mental health services during the pregnancy, postpartum. I remember, this is actually in the middle of the pandemic. I remember I actually traveled for my dad's funeral, and I was quarantined, got a call from one of my patients who was pregnant, and when I spoke to her, had threatened suicide. So I'm on the phone in a foreign country calling the authorities here, getting my office manager at the time to get her help. And we did get her help, and we did get her admitted to a facility and get her the help that she needed. So it doesn't, that problem or that medical condition does not decrease in pregnancy. Actually, sometimes it tends to worsen, actually manifests itself at that time, because sometimes you're dealing with the stress of a pregnancy or other compounding factors, like the economic factor. You have 2-3 kids that, who are dependent upon you. You can't take the time off of work. And, there's so many different compounding factors that really contribute to your mental health. So being a pregnant person does not at all exempt you from any of that. And another thing that I find is that sometimes I get a pregnant person with a history of mental disorders such as depression, anxiety, and they've self-discontinued their medicines. Please don't do that. Wait until you see your physician, and we'll figure out what we can do with your medicines. We want to keep you safe. We want to keep you stable. So please just don't self-discontinue your medicine. At least pick up the phone first and give us a call, and we'll help you navigate that. But yeah, you can stop your medicine and they end up in a mental health crisis, and we don't want that. We want to keep you not waiting in the ER for 30 days or trying to, find a place for you. I did find a few places even within Houston that actually did provide really, really good services for pregnant people or postpartum, peri-postpartum, that I was able to plug them into those services. But sometimes it is actually a very long wait to get patient services. Sometimes I find myself having to stop them like on an antidepressant because it's 6-8 weeks before they can get in. So I do my best really and try to help navigate the services for our patients.
Wow. And I'm really glad, Dr. Sharon, that they have been working on investing in covering more maternal mental health services postpartum. Because postpartum depression, we've learned it's real. We learned there are stages to it, and it can become very severe. So I hope that we improve upon this, stress the importance of it in all populations so that people can get well. So thank you, Dr. Sharon, Dr. Dan. The last part of this really is about the Affordable Care Act. And you both were talking about the worst thing is that you need help. You have cancer. You have acute abdominal pain. You need to go to the ER, and you're worried about if you can pay for it. The Affordable Care Act has been misconceived as being in ruins or unaffordable under certain candidates. And I'll say a couple of things briefly. The fact is that the ACA has expanded health coverage for millions of Americans. It's still the cornerstone of what U.S. healthcare is. Under Biden and Harris, subsidies for the ACA have been taken effect, and they've increased, making premiums more affordable. Right now, the ACA enrollees are saving about $700 per year on average. Some cases, it's even more than that. It's also at record enrollment, which is great. Unfortunately, these subsidies expire at the end of 2025. So the importance is we got to figure out something. If the Biden-Harris continuing the ACA, if that's not working for Trump, there has to be a plan and not a concept of a plan, which we haven't heard yet for the Trump campaign. Trump's stance is, and what has been done, in 2017, he attempted to repeal and replace the ACA. That didn't work. That would have actually increased uninsured Americans to 51 million. He also deprioritized enforcement of the individual mandate, and that was the individual mandate, and there was a penalty if you did not mandate it. He reduced the penalty to $0. So basically, what does that mean? That people are supposed to be affording coverage to people won't get reprimanded if they don't. As a candidate for this election, he basically says he's never going to give up on repealing the ACA. And recently, as I mentioned before, his vice president candidate, Vance, said that his vision is to deregulate, again, the ACA, which is the Affordable Care Act, which could be a problem because what will happen is those with chronic illnesses and diseases will have a higher premium, which is not going to help. Harris's and Walz's stance is similar to what they've been working on with the Harris and Biden administration. We know that Walz is Minnesota governor, the same things that we've seen. He's been leading the initiative on capping insulin cost and extending coverage under Medicaid. Both of them also want to expand ACA subsidies and allow Medicare to negotiate drug prices and improve access to health care for those underserved populations, because that's what we're seeing is there's discrepancies in certain populations. The administration had achieved, again, record enrollment in the ACA marketplace plans. And these are not just in blue states. These are also in red areas that we're seeing this increase. So it should be bipartisan. It's healthcare. They're also proposing to build on the provision in the IRA. They want to make permanent expansion of the ACA subsidies. Something else that Harris had mentioned and we heard about was she proposes to work with the states to cancel medical debt for millions. That should not be on your credit score that you have medical debt. I 100%, I agree with that because I feel that a lot of us that are struggling, some of the debt that is healthcare debt. You have cancer, you have to deal with chemo. That is the proportion of your debt, unless you have medical school debt, which is a whole nother thing. So she announced that she's going to remove this debt from credit reports of 15 million Americans and encourage state and local governments to act to reduce the burden of medical debt. So we shall see. Your thoughts on that, Dr. Sharon and Dr. Dan?
I definitely, so a couple of things.
Yes.
One, healthcare is a right and not a privilege. I think we all agree on that, and I think most of America agrees on that. So you need to vote for somebody who's going to at least believe in that. The second part is that with regards to repealing the Affordable Care Act, that's a non-starter because a concept, a framework is not substance. And people spent a lot of time, Obama administration, although I'm a little bit biased because I did serve in that administration, that notwithstanding, worked on that and they finally got that together. And Biden added his own twist to it to only improve ACA. So we're not trying to go back to that. And that those sounds like a campaign slogan. We really don't want to go back to that. Again, I'm trying to not be political, but these are really facts and people can look those up to understand that. And when it affects our communities, brown and black communities, and white and accessible communities, they actually, people will see how important this is. And we see it because we see the end user, the patient who comes to our emergency department or to our clinic or who's getting examined for whatever reason, and they don't have access to preventative care or even curative. things, or palliative care, the care that they can get to help them get a little bit better, even though we know there might be an end time for them. So those are some of the things that I think are very, very important and non-negotiable. The other part with regards to this whole healthcare system is us understanding that just because we feel good or don't see any symptoms doesn't mean we're not sick or we don't need to get checked. And I think an importance of emphasis on prevention and emphasis on all what we've built and learned from COVID, where we've gotten into communities where they've actually began to trust the healthcare community, where those fundings came to support the communities at the barbershops, at the hair salons, in the communities, at the churches, at the mosque, synagogues, wherever it was, where they were able to access care. Please support that. And at the state and local government, you need to make sure your elected officials understand how that worked during that time and build on it. We don't want to tear it down and only to have to rebuild this again. And that trust that has been built during that time, politics has already undermined that. We need to make sure we build and strengthen what we have, especially given that we're also going into this season with flu, with RSV, COVID, and other things that we don't even know that we need to be prepared for. Hurricane we just talked about too.
Those are great points, Dr. Dan. Dr. Smith?
Yeah, for me, I think the goal really should be is to improve upon the Affordable Care Act. It's not perfect, but the goal is to improve upon it. I don't know how you try to throw 40, 50 million people off an insurance plan. That would be ludicrous. So what do? Just leave people naked and subjected to what? No insurance? Or for those who may have private insurance, they raise their rate, deny them coverage because of a pre-existing condition? So that would not be a good thing. So I definitely do agree with Dr. Dan. Look at both candidates, see we know who, enact those policies that actually help people, because I just don't see how we would just not have health insurance, number one, or if you have health insurance, you pay a higher premium because you have a pre-existing condition, or you wake up today, I have a diagnosis, and then they just throw you off the insurance plan. So that's not good for anyone. And then another thing in terms of medical debt is like one of the number one cause of bankruptcy in this country.
Yes.
Thank you, Dr. Sharon.
Great. Yeah.
Right.
Well, that needs to be addressed. And I love that that's an option. So it doesn't go into your FICO score. These are the things that put people behind, and it's not of their own
not
cause.
Able to buy a house, not able to get a loan for a job. Great point.
Yeah. So, so those are things that affect not just your health, your whole life, and then even your future health, because that stresses you out. It stresses you out and adds to, depression, anxiety, and everything in between. So, yeah, we don't need to go back before the Affordable Care Act. And I don't know how we're going to throw 50 million people off of the Affordable Care Act. It's not happening. Let's improve on it and expand it.
Well, I think we covered a lot today. I hope you guys, whether you listen to it in your car, at home, I appreciate you. Get ready for the election. Start thinking about mental health. Start thinking about drug prices, Medicare and Medicaid. Whether it doesn't affect you now, it could down the line. It could affect a loved one. You could have cancer unexpectedly and lose your job at the same time. So think about these things for the election. We kind of want to expand. So next time we will talk about the abroad. We will talk about how the election is going to affect the healthcare of the world. WHO is something big that we've gone in and out of because of future presidents getting us out of the WHO. And then luckily with Biden, we're back in with the WHO, and the importance of global health. We have to understand that. In addition, immigrants. People come here from all over. This is a melting pot. And what is healthcare policies going to be with immigrants? Very important to touch upon those and other things. So stay tuned for next time. Any final thoughts, Dr. Sharon and Dr. Dan? And thank you guys for being here.
Yeah, thanks for having us. We're only a flight away from the next viral pandemic. So, yeah, we really got to talk about that topic, about figuring out how we take care of our immigrants. So I'm a child, firstborn generation American. So my parents were immigrants, and several of us are. So we all make up this America, and I serve my country. So I wish somebody would tell me something about myself. So anyway, I digress. Go ahead.
Dr. Sharon?
Dr. That is on fire tonight.
I know. I love it.
So, I mean, I'm an immigrant, but I'm a contributing person in society. You know, my contribution helped build this country.
Sure did.
In addition to that, I'm a healthcare provider. So I think that I definitely contribute to this society. And in terms of global health is important because as we see with the pandemic, even though it started in Wuhan, China, look what happened.
We
right?
all travel.
We all travel. We all travel. So WHO is not something that we should ever dismantle or not be a part of. Because if you think one so-called virus in Wuhan wasn't going to come here, well, look at what happened. So we need to be prepared. So we don't need to be not a part of the World Health Organization. we need to be prepared for the next pandemic. I hope it doesn't happen in my lifetime, but didn't think I was going to be a part of a pandemic in my lifetime. So here we are.
Yeah, and we talked about that last time, how we had, unfortunately, during the presidency of Trump, the pandemic preparedness team was disbanded. And we talked about the effect of that with Dr. Atusa. So listen to that. And stay tuned for the next one as we do talk about global health and the healthcare of immigrants, because it's a melting pot. That's what keeps this world going on. The doctors, the teachers, the healthcare workers, the taxi car drivers, everybody together. So let's be prepared and informed, and be prepared for this hurricane that's coming up. So thank you all, and have a good evening. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.